This is Commissioner Lumen May with May's Message. We're here today with the Department of Health kicking off their U=U campaign. We want to encourage citizens to get tested, to do your HIV testing, but not only that, we want to encourage people to do their COVID-19 testing, their diabetes testing, their high blood pressure, any of the health detriments that could cause you to have underlying conditions. We want our community to stay healthy. So please join me in District 3 in getting tested. It's very important for your health.
A hearty good morning to everyone. My name is Maurice Moody. I'm with the Florida Department of Health in Escambia County. I am the HIV/AIDS Program Coordinator for Area 1, covering 4 counties from Escambia all the way to Walton. First, I want to thank Reverend Thomas and his staff in the city of Pensacola for allowing us to use this beautiful, beautiful community facility. And next, I want to thank those who are on the dais with me, starting with my coworker at DOH Escambia, the Director of the Communications, Health, Education, Nutrition, and Public Health Preparedness Division, Dr. Vanessa Phillips. I also want to thank the Director of Operations for Community Health Northwest Florida, Mrs. Erica Douglas. And of course, a gentleman who needs no introduction, District 3 County Commissioner, Escambia County, and former Chairman, Mr. Lumen May. Thank you all so very much. And certainly want to thank the media for being here too, to help us to share this very, very important health information. You know, the media is an integral part in helping us in public health to discharge our duties, and we really do appreciate you. So why are we here this morning? Well, we're here to announce that DOH Escambia unveiled last week an important HIV prevention campaign that we placed on 6 billboards across the city, as well as this placard that is on all of the city buses. The message is very simply, U=U. That means undetectable equals untransmittable. So when a person is HIV positive and has an undetectable viral load, he or she cannot sexually transmit HIV to another person. And that is a game changer. Now, the viral load is the amount of HIV in the blood. And one becomes undetectable when the viral load falls below 200 copies per milliliter of blood. When HIV is in the blood, when HIV in the blood is undetectable, it is also undetectable in the vaginal fluid, semen, and rectal fluid. So having those who are positive becoming undetectable is one of the ways in which we are going to get to zero. Now, getting to zero simply means no more new HIV infections and no more AIDS-related deaths. Therefore, it is critical that we continue our testing efforts to identify those who are positive so that we can link them into care. The Centers for Disease Control and Prevention states that fewer than 40% of the people in the U.S. have ever been tested for HIV. That means over 60% have never, ever been tested. And that's problematic. Considering that you have 1.2 million Americans who are living with HIV, and of that number, 14% are unaware of their status, the implication is that there are a host of individuals who are unknowingly transmitting the infection. And research shows that when people are aware of their status, they take steps not to infect others. Let me share this illustration with you. It's a model that was published several years ago. You have 2 individuals. They're both 20 years old, and they both were just diagnosed with HIV. You have one person who gets into care, stays in care, is adherent to his medication regimen, and is undetectable. The other person just simply dismisses the results, is cavalier about it, doesn't give it any attention whatsoever. Now, which of the 2 will ultimately succumb to AIDS complications within 10, 12, 13 years? You can answer that. We all know that. It's a rhetorical question, right? The person who does not get into care. And that's why, again, it is important that people know their status, get into care. And we know, too, that based on this model, that those who are in care and are undetectable can live well into their 70s. That's important to know. So the medication works, testing works, prevention works, for prevention is preferable to cure. And this is the message we want to give out to the public today, that HIV is a chronic infection, it can be managed, and that no one needs to transmit HIV in this day and time. And so we encourage people to get tested, to know their status. We encourage people to engage in prevention, which means reducing your number of partners, getting tested along with your partner before intimacy, sharing the results with each other. And if one doesn't want to be tested, if one doesn't want to share the results, that should be a red flag. And also, we encourage people never, ever to share needles. That is a major risk factor in spreading HIV as well as hepatitis. So we can stop the spread of HIV. We can defeat HIV. I truly believe that. But we have to be very, very cautious, and we have to engage in care. Again, undetectable equals untransmittable. I appreciate it. The next up, we're going to hear from Mrs. Erica Douglas with Community Health Northwest Florida. Thank you.
Thank you, Maurice, and good morning, everyone. It is a privilege to be here and have an opportunity to speak with you this morning. It was on November the 7th, 1991, and I was just a little girl sitting on the floor in my parents' living room. I was there with my younger brother, my mother, and my father, and I remember sitting in front of the television set because we were anxiously awaiting a very important announcement. And as I stood there with my big bright eyes glued to the television set, I watched as one of my favorite all-time basketball NBA players, Earvin Magic Johnson, take the stage. And what he would say next would forever change my childhood and later go on to impact my adulthood. He announced in front of the entire world that due to HIV, that he would be retiring from the NBA. Now, as a little girl, I did not quite understand what HIV was, and in fact, that was probably the first time I had ever heard those three letters being used together in the same sentence. But what I did know was that whatever this HIV thing was, it had to go, because it was impacting my Tuesday night basketball game watching. What Earvin Magic Johnson did on that day was very bold, and it was very courageous, because during that time, especially in the 90s, it wasn't very popular for individuals, especially of a celebrity status, to be so open about their HIV status. And so now, on November the 10th, 2021, almost 30 years to the day, we are able now to stand before you with a different message, a message of hope, through the unveiling of the U equals U campaign, or undetectable, untransmissible. And like Maurice Moody just mentioned, when you have an undetectable viral load, you are unable to transmit the virus sexually, which is absolutely a game changer. Dr. Anthony Fauci, is that how you say his name? Okay. He is quoted by saying that the U equals U campaign is the foundation of being able to eradicate HIV altogether. Now, how exciting is that? And while U equals U, U also equals understanding and unity and being unbroken. And U equals us as a community. And in order for us to continue to push that needle on HIV, it's going to take a united and collaborative effort from all of us to make sure that HIV continues to keep us unbroken. Now, we have to keep in mind, HIV does not discriminate. It doesn't care if you're black or white, if you're Asian or Hispanic. It doesn't care if you're a Republican or a Democrat. It doesn't care if you are an NBA All-Star or the captain of your high school cheerleading team. It doesn't care if you're the CEO, the COO, the ABC, the LMNOP of your organization, of your life, of your home. It is unbothered and doesn't care about your socioeconomic status. So what can we do? Maurice mentioned a lot of great things, and I'm going to piggyback off of some of those. How can you support this U equals U movement? One thing is to create awareness. We all have some sort of connection to social media, and we love our hashtags. Hashtag U equals U, it's simple. We also have World AIDS Day coming up just next month. Hashtag WAD for World AIDS Day. And then making sure that you protect yourself. Don't share needles, whether it's for recreational purposes or for medical purposes. And of course, practice safe sex. Another way, know your status, know your status, know your status. We have several HIV testing sites peppered throughout our community. And if you are looking for one that's close to you, I encourage you maybe to go online or to contact a representative from our local HIV program office. They will be more than happy to help you. Community Health Northwest Florida, we support the U equals U campaign. And we also support the CDC's recommendation of individuals 13 to 64 to get tested at least once in a lifetime. And for those who engage in more riskier behaviors, once annually. And again, if we are going to move the needle on HIV, change starts now. We have got to break down those barriers that HIV has created for us and be able to move our community into the direction of hope. And in the words of our former President of the United States, Barack Obama, and I'll read it so I won't misquote it. He says that change will not come if we wait for some other person or some other time. We are the ones we've been waiting for. We are the change that we seek. Let's be that change. Thank you. Oh, I have to introduce the next speaker, who needs no introduction. Coming up next to the podium is Lumen May, the Escambia County District 3 County Commissioner.
Thank you for such a lovely introduction, Erica. I do appreciate it. First, let me thank Mr. Moody Maurice for the continuous effort and your efforts to educate about HIV, particularly in the African American community. Oftentimes we're called to duty and responsibility by our jobs, but the things that we do outside of our job is because of the passion. And your passion for better health for this community is commendable. So let me say that throughout this pandemic of the COVID-19, we've had strong partnerships with the health department, with community health, and on the front line, you have seen Eric in community health, you've seen Dr. Phillips in the health department working with citizens. And as we think of HIV and many of our friends and family members that we've lost to underlying conditions because of COVID-19, HIV is one of those underlying conditions. But this is a condition that can be controlled. And that's why we're happy, District 3 in Escambia County, to partner with U equals U campaign, because it is about you. It's about each and every individual citizen that resides. Because the number one priority of an elected official or of a community should be the health of its citizens. And this is just another way that we're partnering with our state, our delegation, our health department, our community partners in our county and our city to make sure that our citizens maintain good health. Unfortunately, HIV disproportionately affects the African American community, just as many other health detriments that affect our community. But we know that we are making improvements. Of the new cases that were diagnosed in Escambia County in 2020, 60% of them were African American. And we know that many times it's because they're not tested. There are not opportunities. And so we're glad to partner with Mr. Moody and the mobile units that he's doing and the community outreach that we're doing at the Brownsville Community Center and places like here at Woodland Heights. And so someone's watching and say, what can I do? you can encourage your neighbors, your nephew, your nieces, your cousins, your brothers to please get tested. Whether they're getting tested for HIV, whether they're getting tested for high blood pressure or diabetes, or whether they're getting tested for COVID-19. Because we should not lose another individual due to any of these chronic diseases that we've suffered throughout this pandemic. So please join me in supporting the Department of Health in the U=U campaign, and tell your neighbor, tell your friends that we all can make a difference by just spreading the word. Thank you, and God bless. And I have the wonderful, wonderful pleasure of introducing Dr. Vanessa Phillips. I'm going to give you as long an introduction as Erica gave me.
It is my pleasure to be here on such a platform with such amazing people. And as they have finished their sessions, I wonder, what can I do? What can I say to come behind that? But the things that I heard were passion, I heard education, I heard partnership, and I heard access. So one thing that's amazing about the public health work that we do is more than 3 decades after HIV, the first HIV diagnoses were made, public health has responded, and responded in a major way. That response has had Florida to become the national leader in HIV/AIDS testing, and has drafted many successful ways to incorporate grassroots and community efforts to address HIV/AIDS in our community and in our great state. The Florida Department of Health has identified reducing transmission of HIV as one of its 7 priority goals, and we've adopted a comprehensive strategic approach to preventing HIV transmission and strengthening patient care activities. 4 ways we are doing that. We're implementing routine HIV and sexually transmitted infection screenings in both healthcare settings and non-healthcare settings. We will come out. We've provided rapid access to treatment. We test, we treat. We've provided and promoted access to medicines like PrEP and MPEP. And in instances like today, we have increased HIV awareness and community response through outreach, engagement, and messaging, while we have you, our partners in the media, here today. The department has taken pride in partnering with such amazing community organizations and businesses alike to both spread the word and increase opportunities for testing and care. That said, if you are a business and would like to partner with us, please, we welcome you. We are about taking care of our community. Today, we focus on the fact that HIV is preventable. Taking PrEP, using condoms, and other methods mentioned by Mr. Moody are able to significantly reduce your risk of acquiring HIV. And if you should be diagnosed with HIV, there are strategies and treatments in place to help you reach the undetectable phase. Now is not the time for stigma. Now is the time for excitement, because there is treatment, because it is preventable. Now is the time for focused action. Knowing your status can help protect you and your community. And like it was so eloquently stated, you equals you.